What is immunohistochemistry for bladder adenocarcinoma? Have you ever wondered how doctors identify different types of bladder cancer? One important tool they use is called immunohistochemistry. This laboratory technique helps to pinpoint specific proteins in tissue samples taken from bladder tumors. It plays a crucial role in distinguishing primary bladder adenocarcinoma from adenocarcinomas that have spread from other organs, like the colon. When a tissue sample is collected, it undergoes staining with antibodies that attach to certain markers. These markers can then be seen under a microscope. This process is particularly vital for bladder adenocarcinoma because primary and secondary adenocarcinomas can appear very similar when viewed through a standard microscope. The differentiation between these two types of adenocarcinomas is essential. It can significantly influence treatment options and the overall prognosis for the patient. For instance, some key markers used in immunohistochemistry for bladder adenocarcinoma include CDX2, cytokeratins CK7 and CK20, carcinoembryonic antigen, and thrombomodulin. CDX2 is a nuclear transcription factor that is typically found in intestinal cells. It is strongly expressed in colorectal adenocarcinomas, but is usually negative or only weakly positive in primary bladder adenocarcinomas. If CDX2 is present in a bladder tumor, it may suggest that the cancer originated in the colon. Cytokeratins CK7 and CK20 are proteins that help in identifying the origin of the tumor. Primary bladder adenocarcinomas often express both CK7 and CK20. In contrast, colorectal adenocarcinomas usually express CK20 but not CK7. However, there can be overlap, so these markers alone cannot definitively identify the tumor's origin. Carcinoembryonic antigen is another marker that can be found in both primary bladder and colorectal adenocarcinomas, which makes it less useful for distinguishing between them. Thrombomodulin, on the other hand, is more commonly found in bladder adenocarcinomas than in colorectal tumors, making it a supportive marker in the diagnosis. Other markers, such as 34-beta-E12, vilin, and beta-catenin, can also provide additional diagnostic information. By using a combination of these immunohistochemical stains, rather than relying on just one, pathologists can improve the accuracy of their diagnoses. This distinction is critical for determining the best clinical management and care for patients. In summary, immunohistochemistry for bladder adenocarcinoma is a valuable diagnostic tool. It helps differentiate primary bladder tumors from metastatic adenocarcinomas, particularly those from colorectal origins. This process is essential for accurate diagnosis and effective treatment planning. Always consult healthcare professionals for personalized medical advice regarding bladder health and cancer.